This segment of Delmarva Life is brought to you by Chesapeake Eye Center.
Well, this is the time of year when so many of us like to get outside and enjoy the sunshine.
But did you know that depending on the color of your eyes, you may be more sensitive to sunlight, and if you're not careful, you could be putting your eyes at risk. So joining us today to help us better understand is Dr. Todd Bisak, ophthalmologist at Chesapeake Eye Center, PA, with locations in Berlin, Salisbury, and Millsboro. Thank you so much for coming in.
Thanks for having me. It's always a pleasure to be here with y'all.
Let me cut right to the chase here. If you have lighter colored eyes, you're more at risk than if you have darker colored eyes?
That actually is true. And we're going to get into why that is, but first I want to talk about some of the anatomy of the eye that allows some of those danger signs to actually occur in the eye.
Okay.
So I have a little model of an eye here in front of us, and I'm going to point out that inside the eye, kind of back behind the cornea is the front window of the eye, but behind that we have the iris, and that's the colored part of the eye.
Okay.
The iris is made up of different pigment types, and really specifically two types of pigments, brown and black. And those are the only type of pigments that occur in the iris. So the color of your eye is actually determined on how much pigment you have. If you have a lot of pigment, you have dark, hazel, or maybe even brown eyes.
Right.
Less pigment is the blues and the greens.
Oh.
So that's actually what's linked to the color. We all actually technically have the same color of eyes. How much pigment we have is what we perceive as the eye color.
That's interesting. So are light eyes a problem?
Actually, they can be, and I'll tell you why. I have an analogy that I tell about two rooms that each have a window in them. And we have one window that has sheer curtains over the window, and one that has opaque curtains. Naturally, the window that has the sheer curtains is allowing more light into the room.
Okay.
And the opaque curtains is allowing less light. The reason that applies to the eyes is that is UV light that's coming into the eye, ultraviolet light that's produced by the sun, that can have damaging, harmful effects on really all parts of the eye and all parts of the body as well.
So what kind of damage are we talking about that's associated with UV light?
Most notably is age-related macular degeneration, which is a devastating disease that can potentially cause serious effects on central vision, the type of vision that we really don't want to lose. If we lose some peripheral vision, not as important, but that central vision is so important to driving, watching TV, reading, recognizing faces. That can.
And you've got a grid that you can show us what the difference is.
I do have a grid. So our macular degeneration patients are patients that we are following for macular degeneration. We give them a copy of this grid.
Okay.
And it can show distortion in one's vision.
The left is what it should
The left
look
is a
like.
normal,
Okay.
and the right is some sort of bent lines, distorted lines that can be some of the initial signs of macular degeneration.
How about that?
In its later form, macular degeneration can cause total blindness in the central part of the vision.
Wow.
Interesting. Now, you have light eyes, I have dark eyes, so am I safe?
Not totally, okay? You can't, just because you have dark eyes doesn't mean you should just go out there and let the sun hit you from all directions. Sunlight can affect all different types of eyes, and there's a few other conditions that I want to talk about. The first one is photokeratitis, or better known as welder's burn. Okay. We see this often, especially in the summertime, when the cornea, or that front window of the eye, essentially gets a sunburn on it. This is very similar to a sunburn of the skin, but a sunburn of the eye. Okay. This is very painful. Causes blurred vision, causes photosensitivity, very painful to be in the light. Often occurs when welders actually forget to put their mask down, and maybe for the more lay person when they enter a tanning bed and don't take the appropriate precautions to cover their eyes, you can get a terrible burn like this.
Happen.
Yes.
All right, this next one we couldn't even pronounce.
Yeah, this one looks pretty dramatic. It's something called a pterygium, and the white part of the eye has a little skin that covers it called the conjunctiva. Okay. Ultraviolet light can cause that skin to proliferate and actually grow onto the cornea. As you see in this photo, that skin is growing probably maybe a third across the cornea. If it were to pass across the center part, it could occlude the vision.
Right.
You see this in folks that spend a lot of time outside, a big part of their day, farmers or surfers. This can be treated in surgery, but nonetheless, we all want to avoid surgery when possible.
Right. And then finally, cataracts.
Cataracts are an extremely common condition worldwide, and it is a clouding of the lens that occurs inside the eyes. The one on the right is actually a cataract. You can see the gray through the pupil there. Okay. And the one on the left, it's nice and clear. So when the cataract or the lens becomes cloudy over a lifetime of ultraviolet exposure, it causes blurred vision. The good thing about cataracts is that they can be easily removed in the operating room. It's a very successful surgery.
So there is really a lot that we need to pay attention to. Is there some way that we can protect our eyes?
Well, especially at this time of year, we're spending more and more time outside. The things we can do are wear a wide-brimmed hat, wear a good pair of sunglasses. A pair of sunglasses has ultraviolet A and B protection.
Okay.
And you know, picture of a young man who's become famous on this show. This is my son. But the reason I show this picture is it's the importance of starting good habits for young children.
Early on, yes.
Very interesting. Thank you
Yes.
so much, Dr. Bezak. And of course,
Thank you for having me.
if you would like to read more about eye health from Chesapeake Eye Center, go to delmarvalife.com and click on the show tab.